First off, thank you for having me and for the work that you guys are doing as far as looking at the behavioral health system. I think you can see by this room, the people who are testifying, this is the reason why we're doing the work. The stories we've heard, the stories we're going to hear, this is why this work is so important to fix a system that has major gaps and holes. Like I said, my name is Chris Rieder. I'm here as a program director for Mind Springs Health in Eagle County, but also as a member of this community that I care so much about. I've been here since 2004 and been working in this field for over a decade. And I love this community. It's got so many opportunities to do healthy things, fun activities, care for each other, but we have major gaps in the mental health field. The three that I briefly want to talk about in my 6 minutes is obviously the awareness and stigma associated around behavioral health is a huge barrier. Funding sources is a big thing, and then staffing. Those are the three issues that I just want to hit on quick. First, one of the biggest barriers is the awareness and stigma around behavioral health. Everybody's talking about behavioral health more, but there's a lot of people who aren't. And I think there needs to be a wide-ranging, coordinated, well-marketed campaign to talk about all behavioral health issues, whether we're talking about benzodiazepines, whether we're talking about reactive attachment disorder. All these issues that exist need to be talked about and need to hit every demographic, every community, every socioeconomic status. We have to be able to get that stigma out there and get the awareness out there so that people come and seek help when they need it. They know how to recognize help recognize people who need help. As far as funding goes, as a community mental health center, we're really tied to state dollars through Medicaid. And with those state dollars, we have huge administrative overhang. From trying to hit performance measures to pass audits, a lot of that administrative burden takes away from our ability to create high levels of care. Those targets that we're trying to hit are often moving targets because of changes in funding, changes in enrollment numbers, changes in performance measures. So just overall, the administrative burden stops us from being able to do the work that we really are here to do. Beyond that, private insurance, the coverage for mental health care versus physical health care, it needs to be the same. If somebody is paying for their insurance, has insurance, they need access to the behavioral health services that they need. And uninsured. In Eagle County, the cost of insurance is so high. We have transient workforce. We have such a high cost of living that a lot of people go without insurance. If you can't get the services you need, even if the awareness is there, it's a major hurdle. So the funding of behavioral health is a complex issue that there is no easy solution for, but it has to be something that is paid attention to. Staffing. We have a wonderful staff, and we have wonderful private therapists, and there are organizations throughout this valley working really hard. But because of the difficulty in funding, the salary range for behavioral health providers is so low. And I can say that personally, seeing the difference between my wife's salary as a physical therapist and mine as a mental health therapist. It's impossible to keep quality people working in the public sector of mental health with the salary ranges that we have, with the high cost of living that we have. And so I think a combination of looking at the funding sources and creating parity in the payouts, looking at loan repayment, housing subsidies, unique solutions to help keep these quality staff members in our services is going to be a huge thing. It's, again, we have tons of people working really hard and they do a great job, but when you get to some of these really complex issues, the more experience people have, the better they're going to be. And so if we have a way to keep those people on through creative solutions, I think that's huge. I haven't even followed this yet. I think one thing I do want to say is it's not all doom and gloom. I think what is happening here in Eagle County is evidenced by the amount of people here, but what has happened is there's been conversation among every organization coming together with an attitude of collaboration, open communication, sharing information. This allowed us to really look at the system as a whole, identify gaps, identify what's working, and then from there we're starting to take the agencies that were already doing the work, coordinating with new agencies, creating new programs, and that the coordination of care is focused on collaborating, not duplicating services, and really helping each organization be our best. And I think if every community gathered the agencies, the government departments, law enforcement, medical providers, and most importantly, the people who are receiving the care, to have these open conversations, to have this collaboration, at that point, you can start getting to solutions. So I think Eagle County is doing great as far as being an example of how that communication and collaboration can start to do really good work. And so I think what you guys are doing as a task force obviously is part of that on the state level. So thank you.